A global pandemic is taking lives, costing jobs, and challenging governments worldwide. Could we have seen this coming? And could COVID-19 change the world as we know it? Hello and welcome to Bigger Than Five. I'm Rida Fakhri. The world is reeling as COVID-19 continues to sweep across the globe. The death toll is rising, and even with restrictive quarantine practices in place, infection rates are growing exponentially by the day. The virus has halted travel, tanked the global economy, shuttered businesses, transformed lives, and tested healthcare systems worldwide. Border closings have been unable to stop this invisible threat from spreading from country to country, ravaging communities and impacting the vulnerable and the elite alike. Here in the United States, it was a delayed fight for containment. With now all 50 states reporting cases, the federal and local governments are scrambling, preparing for the worst. The president says he's at war. We'll explore the response with US officials who headed some of the agencies that are now tasked with confronting COVID-19. But first, we go to South Los Angeles to hear from one of the first responders.
Hi everyone, my name is Pablo Barrios. I work here at St. John's Wild Child and Family Center. I'm a community health worker supporting with triage and crowd control. At the moment, we still have our doors open here at St. John's.
You know, we're serving the homeless, we're serving the vulnerable, we're serving the undocumented, we're serving low-income families. Those are the folks who are most vulnerable in a pandemic like this.
We're taking the temperature of our patients, and if they show any symptoms, we're triaging them away from our lobby.
The situation is critical on the front lines here. So we don't have the cuffs for our thermometers so that we can test everyone. We're running out of those. We're running out of N95 masks, surgical masks. We don't have lab coats. We don't have enough gloves. For our 5,600 the patients we see a week, we have 25 tests. We're on the front lines, and we don't have the tools that we need to protect our workforce and to protect our patients from the spread.
We have our triage tank where we're separating patients. If any patient has a cough, a high fever, shortness of breath, before they can even enter into the clinic, we're triaging them here in this tent.
One of our employees' fathers works in a factory in China, and they make masks. And so she was able to contact her dad. We were able to wire him a whole bunch of money, and hopefully by Monday, we'll have 100,000 masks delivered from China. We had to go to China to get them. And I'm afraid because of the failure of the Trump administration to move decisively, their failure to get us the test kits we need, their failure to get us the supplies we need, and the fact that we lost 8 weeks since the first case hit the United States, that we actually got those tests out to providers like us, I'm really afraid that we're way behind the curve and we're going to see a big spike in the next couple of weeks that we could have avoided.
So how could it be that workers on the front lines are scavenging for resources? I'm now joined by Dr. Tom Frieden. He was the head of the Centers for Disease Control, the CDC, the U.S. agency that oversees the control and prevention of infectious diseases under President Obama, and is currently president and CEO of Resolve to Save Lives. So this is the picture, Dr. Frieden. First responders painting a very dire, damning picture. No thermometers, no masks, no ventilators, and the list of basic medical equipment that's lacking is long. Why was the CDC so unprepared for this pandemic?
This really isn't about CDC, this is about society. And what we're seeing in Wuhan, in Italy, in New York City today is that this is moving so quickly that every city needs to be ready for a massive scale up of capacity. And the time that we buy, either because it hasn't spread here yet, or because people are sheltering in place, is precious minutes, days and hours to ramp up our ability to protect healthcare workers and care as effectively as possible for patients.
But what do you say to those who accuse the CDC of botching its own development of tests?
This time, the CDC test didn't go right, and that's really unprecedented. In all of the prior episodes, H1N1 pandemic, for example, CDC was able to make a test within 2 weeks, to develop it, get it validated, get it approved by the FDA, and then get it sent out to every state in the US and more than 140 countries without a glitch. Something went wrong here, but not just with the CDC test. Something also went wrong with the Food and Drug Administration, allowing hospitals to develop their own test, and with the private sector coming in with tests as they did in South Korea and elsewhere. But now it has to be not focused on what went wrong in the past, but rather what can we do to protect people as effectively as possible.
Right, but I mean, would you agree that the central tenet of this approach needs to be focused on testing, and that if you do not test enough people within society, those who are asymptomatic and could be infecting others, then you will not get far enough in handling the situation, putting a stop to it?
I think that's wrong, and it's an important error. Testing is crucially important, but it has one role within the war. Testing is important, for example, early on to find the first infections and then to do intensive contact tracing, quarantine of contacts, isolation of cases, protection of healthcare workers to prevent an explosive spread as happened in Wuhan, Italy, and sadly now in New York City. So testing is important in that situation. Where we're in a situation like Northern Italy or New York City, where there's so many patients, testing does not have a major role. In fact, in New York City, we're telling people, the health department is telling people appropriately, if you're sick, if you're mildly ill, stay home.
That goes counter to the recommendation of the Director General of the World Health Organization, who keeps saying test, test,
If you want to have an inaccurate report, you're welcome to do that.
This is what he said.
Let's be very clear on what I'm saying. Please let me finish. There is essential role for testing, and WHO is exactly right to say test, test, test in certain circumstances. When it's first coming into society and in a situation like Korea, where you've gone over the peak and you're trying to find every case. But what is appropriate to do depends exactly on where you are today. And where we are today in New York City is so many cases that we cannot safely test them, even if we had massive infrastructure, and the result would be nothing different. You would say to somebody, get tested and now go back and go home and isolate yourself. Now, in an ideal world,
would you say that the US knows where it is today?
No, the US is behind in this, and every country in the world needs to be proactive in developing their capacity, not just to test, which is crucially important, but also to do contact tracing, isolation, expansion of oxygen therapy, and intensive care work. Working with communities to figure out how to shelter in place safely so we can reduce the number of infections. This is a comprehensive approach of which testing is a crucial part.
You're a former CDC director, and you said recently that you would feel a lot safer if it were clear that the CDC were both at the table and at the podium. Are you saying that the CDC has been sidelined, and if so, why?
It does appear that that's happened. I'm not in the government now, so I can't say why, but I can say that the CDC, despite the significant problem it had with the test kits, remains a great public health agency. There are more than 700 public health professionals who work just in the one center that deals with viral lung infections. Having them fully engaged in this will improve the response in the US and around the world. All of us are in this together against a common enemy, the dangerous microbe of coronavirus. And working together, we can reduce the health and societal harms that it causes.
How do you respond, Dr. Frieden, to Trump's accusations that he inherited a broken system? In fact, he has blasted the CDC and the Obama administration's handling of the H1N1 outbreak back in 2009, which killed 300,000 people worldwide and about 12,000 in the United States. How do you respond to his accusations?
I'm very puzzled by them. They don't comport with the facts. The facts are that in H1N1, the CDC got 1 million tests out very rapidly, beginning just about 2 weeks after the virus was first discovered. Not everything went well. If you look at the H1N1 response, the industry that made vaccine was slow to make it. There was a problem growing it, and therefore the vaccine didn't come as rapidly as everyone had hoped. And certainly there's no response in history that's ever been perfect. So we always look back and say, what could be done better? But right now, the important thing to do is to look forward and see what can we do together, not just in the US, but around the world, to confront what is a common enemy. The more we recognize that there is solidarity here, the safer and the healthier we'll all be.
How long do you think that these measures that are put in place can actually be kept up? Because you did say that Italy's coronavirus nightmare could actually happen in the United States within days or weeks.
We need to adjust based on what's happening with the virus, how strong the healthcare system is, how strong the public health system is. We need not to open the floodgates to infection, but to open the faucet gradually so that we can manage whatever patients need care safely, preventing more infections of healthcare workers, tracking those who are positive with an intensive testing approach so that we can prevent this kind of widespread transmission that's happening today in New York City.
Dr. Tom Frieden, former CDC director, thank you so much for your time. U.S. health officials say they first learned the coronavirus was spreading in China on January 3rd. We now know that intelligence officials immediately began relaying sober risk assessments to President Trump. But it was not until February 23rd that the president assigned a task force to address the virus, and March 13th that he declared a national emergency. In fact, for years, global health agencies had been warning of a potential pandemic. Yet still, President Trump said it was an unforeseen problem and that it came out of nowhere. Should we be in the situation we are in today? I'm now joined by former Health and Human Services Secretary under George W. Bush and former Governor of Utah, Mike Leavitt. Governor Leavitt, has the U.S. put itself in a worse situation by ignoring the repeated warnings and by being in what seems to have been a state of denial initially and then a state of inaction for a while?
Pandemics happen. They're a biologic fact. They have been part of human history as long as it's been recorded. We've had 3 in the last 100 years. We've had 10 in the last 300 years. The dilemma is that they occur with enough distance between them that every generation tends to forget and has to learn their power and consequence on their own. It's hard as a public official to keep the state of alarm sufficient because anything you say in advance of a pandemic sounds alarmist. As it turns out, after the pandemic starts, about anything you do is inadequate.
But is that really the situation here? Because it was clear quite early on from the scenes in Wuhan that the Chinese were dealing with an unusual epidemic at that stage. And yet, President Trump said this on January 22nd. He said, "We have it totally under control." And then a month later, he said this: "The number of Americans with coronavirus is going to be down to pretty much 0. Was that the right thing to say? Was that the responsible thing to say at that stage?
Given what we know, those statements can't be defended. Generally speaking, as I was, that this is a hard thing to communicate on. We could have known a decade ago that at some point in time there would be a pandemic. And we have not, as a country, prepared the way we should. The reality is we have not, as a world, done so. And there is not an excuse, but there is certainly an understandable circumstance that if they don't happen, but every 30 years, people can be found in a state of lack of preparedness, and now we're paying a price for that.
And President Trump actually says that the lack of preparedness can be pinned on the Obama administration for not having done much to prepare for pandemics. Do you share that assessment? My
purpose today is not to evaluate his statements. The reality is, in what we know today, those can't be defended. But where we are is that we're facing a very grave threat, and we need to make certain that we're doing all we can in the next 4 or 5 weeks to assure that it's minimized and mitigated.
But now President Trump and many other leaders around the world took measures to close off their borders to international travel. But that is one thing. It's quite another to isolate cities, like cities here in the United States, and counties from each other. Should interstate travel, both land and air travel, be stopped at this stage? Would you have suggested doing that as governor?
Well, there's some evidence, according to Dr. Fauci, who is directing much of the health effort in the United States, that closing the borders did have some impact. I've been part of modeling various countermeasures over the course of years, and there's some question about inside a country whether isolating movement does have that effect. We don't really know, but we know that what we can do is spread people out, make certain that they're not transmitting the disease from place to place, and in some cases that it becomes a mitigation strategy as opposed to a containment strategy.
And in terms of what governors can do, and you're a former governor of the state of Utah, President Trump believes that it's up to each state to handle this. But we know that states, in many cases, even the most wealthy among them, including New York, is quite overwhelmed and actually begging for help from the federal government. In your opinion, should the federal government be stepping in, be deploying its military assets, its National Guard in a way that it hasn't previously to help these cities and states deal with this pandemic?
Well, Geeta, there's a role for everyone here. There are roles that the federal government can uniquely play. The creation of a vaccine, which you've already spoken about, that's one of them. Supporting local and state government with additional resources, that's another. One thing that is clear is the federal government, beyond its military, does not have on-the-ground assets. It depends on the states. And one of the things that makes this a unique kind of emergency is that it has to be combated locally. Schools closing, for example, is not a decision that ought to be made in Washington. It's a decision that can best be made in local communities because the situation is different and will continue to be different on the ground in each local community. Should the military be used? Well, that's a possibility. However, we ought not to forget that the military has another job, which is to protect the United States' interests around the world. And history contains many examples where hostile military powers have taken the opportunity when a country is suffering a crisis from help to bring military action. And you can't let your guard down there either.
Governor Mike Leavitt, many thanks for your perspective on this. Thank you. Now, there still is, of course, a lot to learn about the virus, and we look to prior epidemics for information. Ebola, for example, had a death rate of 50%, MERS 34%, and SARS 10%. The World Health Organization estimates the mortality rate for COVID-19 could be as high as 3.4%, though moderate estimates are closer to 1%, which is still significantly higher than the seasonal flu. The problem is it is still extremely contagious, so medical experts still have a lot of work to do before this is over. Will the world be able to come together to fight this virus? Dr. Elias Zerhouni joins me now. He led the National Institutes of Health, the U.S.'s medical research agency from 2002 to 2008 under George W. Bush. Dr. Zerhouni, you were head of this mega U.S. health research organization when SARS, another type of coronavirus, broke out. What lessons, if any, were learned?
Well, we learned a lot, and that is that if you really want to react to a pandemic like this, you have to have certain components that are essential. Early detection, and that is surveillance. You have to know that something is happening. In SARS, unlike today in COVID-19, we really knew from indirect reports that there was a disease coming out of China, but we didn't know what it was. We tried to cooperate. It wasn't really the type of cooperation that you would need. Over time, things have improved, but as you can see with COVID-19, early surveillance wasn't there, and then testing took time to develop, so that we were caught a little bit short.
So what do you make of the lack of testing so far here in the United States, this reluctance to go to the source to know how many people are infected?
I don't know. I think, to me, I don't know exactly what happened, but testing is really critical because you don't know what your enemy is doing, and the virus, how spread it is, how widespread, and the technology is there. I mean, you can see we've been able to scale up very quickly, and so we're in a much better position now. I think it was an underappreciation of the severity of the disease and the transmissibility of the disease. I thought it was, at the beginning, I heard that it was probably not as fast in terms of human-to-human transmission than it turned out to be. And so there was an underestimation, I think, of the severity early on.
But did the world, do you think, in the past few years, certainly since the outbreak of SARS, invest enough into the research that needs to go into preventing and addressing this pandemic and any future pandemics? And I think the lack of a vaccine to deal with SARS gives us a resounding no. Do you agree?
Absolutely. I think, every time the observation I've made is that we've had biodefense issues, with anthrax, and then we try to respond to that. And then when the threat goes away, you sort of go back to sleep. SARS came, and then MERS came, and then Ebola and H1N1. And what I see is that every single time, we react in a grand way, and then after the crisis is passed, we forget it. So today, we do not have a global system of pandemic surveillance, detection, response that is a global system where all nations cooperate. We cooperate on the weather to predict hurricanes. We don't cooperate on pandemics, and this is not right. I think we need to learn from this crisis not to repeat the same mistake of every time we respond and then we disband the response, and then we respond and we disband the response.
And your successor as NIH chief said that the best response to this will be a response that most Americans, in fact, most people would find too drastic, the complete lockdown of entire communities. Countries are doing it. India just announced that it was doing it too. If you were NIH director today, would you suggest taking such measures? Is complete lockdown the best response to this?
Well, absolutely. When you look at the traditional response for public health, this is classic. At the beginning, you try to really contain the disease, and then you try to limit its spread by tracking every contact. But when it grows to what we call phase 3, you have no choice but to separate human beings from being able to transmit to each other and hopefully control the rise of the epidemic so that you can respond to the patients. So this is what we call, lowering the top of the curve. And that is necessary once it gets to the stage we're in today.
But is it complete lockdown necessary, and is it sustainable? Are you suggesting that not just closing borders to each other on an international level is the solution, but perhaps even within the context of the United States, closing off, sealing off internal borders? I mean, to date, a bus can go from New York to any other state in the United States. I mean, do you have to seal borders as well?
So let me tell you a little bit about the science of this. The number one factor that we worry about when there is a pandemic is how many people can one individual infect. So when you're very close together in a church or a restaurant or something, your chances of infecting others is like 2 to 3. So for every person infected will infect 2 to 3 people. And that is not sustainable, because if you double every 3 days or 4 days, then all of a sudden you have millions of people infected. So what you do, you try to separate the chance or decrease the chance of transmitting to someone else by separating people as maximally as you can. It's never perfect. You're not going to put people completely in jail for that. But the more you do it, then the number of cases that you can infect goes below 1. As it goes below 1, let's say half, let's say any patient can infect half, then really within 2 weeks, the disease disappears.
But do you think that that today's political leaders have the historical perspective they need to address this issue, the virus spreading throughout the world, looking at it on a par with other threats when it comes to people's well-being, but also national security?
Rita, if we miss this crisis, if we don't learn from this crisis that affected 148 countries and not put in place a global system of surveillance like we do for weather, then we would have missed the leadership that we need to have ourselves as a country, but the rest of the leaders of the world. If they haven't learned that lesson this time, they will never learn.
What about the responsibility of the private sector? I know you were involved in trying to develop vaccines with one of the major pharmaceutical companies in the world. Mm-hmm. Do you think that the current models that are based on profits are still the way forward?
Well, when it comes to vaccines and when it comes to pandemic response, you need to have a system that is not based on just profits, because there is no profit to be made in a pandemic that is unpredictable. So you need to have a system just like you do for emergencies, and you really have to pre-position those assets and induce industry to prepare for the next pandemic. We can't fight the last war. We have to fight the next one.
Let me just ask you this. You are Algerian by birth, so you're very well familiar with the limitations within the health sector in Africa. This virus has started to make inroads in some African countries and other vastly populated countries as well, like India. Are we headed towards a pandemic of catastrophic, epic proportions, if you put this in context with what we've seen in the past 100 years?
Well, I tell you, if we see what happened in China, in Africa, it will be a major disaster. But so far, so good. I mean, I think that the routes of travel are not as intense in certain regions, in Algeria or Africa, as they are in Europe, between Europe and China, or China and the US. So I hope not, but I can't tell. I mean, I don't have the data to tell you.
We'll have to leave it there. Dr. Elias Zerhouni, former NIH director, thank you very much indeed for joining us.
Thank you, Rita.
And so the United States, the world's wealthiest country, is now grappling with a health crisis its president dismissed and refused to take seriously early on, despite the repeated warnings from his own intelligence agencies, calling the coronavirus a democratic hoax. But with the country facing a recession that could cost him his re-election and anywhere between 3 and 30 million jobs lost, the White House may be tempted to reopen the US to business, as the president has suggested, but the virus may have the final word. From me, Rida Fakhri, and all the team here in Washington, thanks for watching. We'll see you next time.